Cerelac Shishu Aahar, tapping the traditional Indian main meal opportunity. India is the largest market by value for the Cerelac range of infant cereals, where Cerelac has literally been ingrained into Indian traditions for over 35 years. Over these years, it has expanded from a single variant to 12 variants spread across 4 stages. However, the recipes and tastes have never been truly Indian in nature, with all variants being milk-based and sweet in taste. Which is why Indian mothers have always considered Cerelac to be given during breakfast or as a snack, rather than for a main meal. With doctors, Cerelac had never really progressed beyond a state of endorsement. Homemade paps have always topped the charts within Indian homes. This background and an incessant need felt to Indianize Cerelac gave birth to Project Aahar. The key objectives were to cater to Indian tastes and recipes, enabling it to cross over to main meal occasions, win doctor endorsements and take share from homemade paps. The prime contender was khichdi, a smooth and savory pap prepared from mashed rice and pulses. But of course, all this was easier said than done, and the challenges were aplenty. Challenge 1. Protein. Indian standards state that all infant foods need to have a minimum protein content of 15% per 100 grams of dry product. While it was easy to do this using milk, it was making the product sweet. So we came up with the idea of using moong dal powder instead of milk. While we still had to add 4% milk powder, we were successful in extracting a savory khichdi taste plus delivering on protein. Challenge 2. Recipe. The taste of khichdi differs in every state in India, and our target was to develop a unified taste that could cut across all versions of khichdi. After trying out countless recipes and raw materials in consumer labs, we managed to freeze on 2 great recipes. We were next faced with kitchen trial tastes getting lost in translation during industrialization, which we were able to resolve. Finally, we managed to match homemade khichdi in taste. Challenge 3. Benefits. Our range also had to rise above homemade paps and offer something extra to mothers. Our products had rice and wheat, a combination which mothers were never able to make with khichdi at home. We fortified our recipes further with the right quantities of LA and ALA for delivering on the most relevant benefit territory of brain development. Challenge 4. License. A long and arduous process also awaited us when we applied for a license from the Bureau of Indian Standards under processed cereal-based infant food, for which, till date, they had never given a license, since no such non-milk-based infant food product was available in the market. Nevertheless, we did manage to get it in time, determined to achieve this launch in 2012 and no later. Challenge 5. Branding. We carefully selected the sub-brand Shishu Aahar, which means complete baby meal in Sanskrit, a language which is the root to all Indian dialects. Traditional Indian motifs were developed for the background. Bright colors synonymous with India were selected for the 2 variants, which were turmeric yellow for stage 1 and henna green for stage 2. The ingredients were then laid out on a silver platter to give the appearance of a whole meal, alongside a traditionally symbolic silver bowl. Another important local ingredient used was ghee or clarified butter in the recipe. The variant names also had the word khichdi, which puts it in the main meal space rather than a sweet snack. Challenge 6. Trade. The distribution channels were then taken on board through distributor salesman training and tasting sessions with the entire field force. Placement of the products across all hygiene corners were also mandated to ensure product awareness. Challenge 7. Medical communication. No stones were left unturned when it came to doctors. Specific communication in line with our packaging was developed so as to make them take notice of this Indianized range which they did. A true innovation, Cerelac Shishu Aahar was launched in September 2012. The response has been extremely positive. We finally have a range that can establish Cerelac for main meal occasions. The surprise package has been with doctors, with the ones who were earlier only endorsing Cerelac starting to prescribe Shishu Aahar and new ones starting to get converted. Even doctors who were not endorsing Cerelac for many years for want of Indianization have started prescribing Shishu Aahar. The feedback from trade has also been extremely positive, with offtake getting reported pan-India within the very first month of distribution. With positive reactions from doctors, trade, mothers, and even the internal field force, along with a strong product line, which has its roots derived from the strongest of Indian traditions, there is no holding back. Cerelac Shishu Aahar.